Did you know that in Finland, your child can see a doctor, get vaccinations, and visit the dentist, often without paying a single euro? But is everything really free? Or are there hidden costs parents don't see until later? In this video, I'll walk through what's free, what can cost money, and how to avoid surprises with official sources. Hi, and welcome back. Today, I am answering a question many parents and newcomers ask. Are all medical expenses really free for children in Finland? It's a great question, because while the system is generous, the answer isn't a simple yes or no. To get you the most accurate information, I've used official sources like InfoFinland, THL, Kela, and various municipal websites. Don't worry, I'll link all of them in the description below so you can check them out for yourself. First, let's cover the most important legal condition. To access municipal health services, your child must have a municipality of residence in Finland. Think of this residency status as the key that unlocks the door to Finland's public healthcare system. It's what gives you access to the child health clinics, school health care, and so many other essential public services that we'll be talking about today. Without it, you won't be able to benefit from these free or low-cost services. So, let's start with the good stuff. What is completely free for children? The cornerstone of child health care in Finland is the public child health clinic, known as neuvola. These clinics are entirely free of charge. They provide everything from routine checkups and growth monitoring to parenting support and vaccinations for babies and toddlers. The neuvola system is designed to support families from pregnancy all the way through the child's early years, ensuring a healthy start in life. Once your child starts school, the care continues through school health services. These are also free and include routine checkups by school nurses and doctors. It's a seamless continuation of the care that began at neuvola. And what about vaccinations? All vaccines that are part of Finland's national vaccination program are voluntary and completely free. They're typically administered at the neuvola for younger children and then at school for older kids. And finally, one of the biggest benefits, public dental care for children and young people under the age of 18 is provided free of charge in municipal dental clinics. This includes checkups, preventive care, and necessary treatments. Now, what about hospital visits? This is where it gets a little more nuanced. Many hospital outpatient visits for patients under 18 are free in several hospital districts. For example, HUS, the Helsinki University Hospital District, explicitly states that outpatient visits for under 18s are free. This is a huge relief for parents, as it means specialist consultations or follow-up appointments usually won't come with a bill. However, hospital districts can still charge small inpatient daily fees if a child needs to stay overnight. These fees are capped by law, but the exact rules and amounts can vary by well-being services county. So, while an overnight stay isn't completely free, the cost is usually very manageable. So, where do the costs come in? The biggest one is choosing private health care. If you decide to see a private doctor or a private dentist, you will normally have to pay the full private fee up front. Kela, the social insurance institution of Finland, may reimburse a portion of that cost later, but it rarely covers everything. So, going private is a choice that comes with a price tag. Next up are medicines. They are not automatically free for children. Kela does reimburse a portion of the cost for prescribed medicines that fall into specific categories, but there are often co-payments and annual thresholds you have to meet. So, when you go to the pharmacy, you should expect to pay something out of pocket. Also, certain therapies and elective treatments can involve client fees or long waiting lists in the public system. Things like specialized physiotherapy or certain types of orthodontics might not be fully covered. It's also worth noting that recent reforms have changed some of the reimbursement rules, which we'll touch on now. It's important to be aware that there were changes in 2025 to client fee rules and Kela reimbursements. For example, Kela expanded some reimbursements for physiotherapy and dental hygienist visits starting from May 2025. These changes aim to improve access, but it's always a good idea to check the latest rules directly from Kela's website to understand what's covered for your specific situation. Let's walk through a real-life example to make this clearer. Example 1. A newborn baby. All the routine neuvola checkups, the nurse's home visits after birth, growth monitoring, and all the scheduled vaccinations are provided completely free through the municipal system. Later on, when the child goes to school, preventive dental care is also covered. So, under normal circumstances, all of this essential early childhood preventive care costs the family absolutely nothing. Now, for a different scenario. Example 2. A 10-year-old breaks their arm while playing. The emergency treatment and the X-rays at the public hospital are handled within the public system. In many regions, like the HUS area, there are no outpatient fees for children under 18, so the visit to the emergency room and the initial treatment won't cost you anything. If the child needs to be admitted for an overnight stay for observation or surgery, a small daily inpatient fee may apply, up to the district's legal limit. But this fee is usually far, far lower than what you would pay for a similar stay in a private hospital. Finland has a great system to prevent healthcare costs from spiraling out of control. The payment cap. This system, ISU, puts an annual ceiling on how much you have to pay for public service fees. Once your family's payments reach this annual cap, most of the services included in the cap become free for the rest of the year. What is even better for families is that some municipalities may bundle a child's payments with their guardian's payments when calculating this cap. The rules can differ, so always check your local Well-Being Services County website for the specifics. So, how can you avoid unexpected bills? Here's a quick checklist to help you navigate the system. First, use your municipal child health clinics, neuvola, and school health services whenever possible. These are your free, high-quality primary care options. Second, always ask before you book an appointment whether the service is public or private. This simple question can save you a lot of money. Third, make sure you have your Kela card and that your child's municipality of residence is correctly registered. The Kela card can give you direct reimbursements at some pharmacies and private clinics. And finally, check your municipality or hospital district's client fee page online. Many of them posted updates for 2025, so it's the best place to find the most current information. To make this video, I used only official sources that you can trust. I relied on InfoFinland for general information on child health and dental care, THL for details on the National Vaccination Program, Kela for anything related to reimbursements and benefits, and websites like HUS for specific client fee rules. I'm putting direct links to all of these key pages in the video description. This way, you can easily check the exact rules that apply to you right where you live. So, to recap, many essential child health services in Finland are indeed free. This includes neuvola, school health care, the National Vaccination Program, and public dental care for those under 18. However, private services, some medicines, and certain specialized treatments can have associated costs. Knowing the difference is key. If this video helped clear things up for you, please give it a like and subscribe for more content about life in Finland. And I'd love to hear from you in the comments. What has your experience been? Was your child's care completely free? Or did you end up paying for something? I'll be reading through your stories and might even do a follow-up. Thanks for watching.